This is a systematic review and meta-analysis from November 2020 examining the effect of the ketogenic diet on glycemic control, insulin resistance, and lipid metabolism, all in patients with type 2 diabetes. We know that type 2 diabetes is a major global health concern with increasing rates. According to the CDC, more than 37 million Americans have type 2 diabetes, and this is rapidly increasing. Worldwide, there are like 300 million adults with type 2 diabetes. Previous meta-analyses have proven the efficacy of the ketogenic diet in weight loss and in glycemic control. However, systematic reviews specifically focused on patients with type 2 diabetes are limited. According to the authors, the impact of the ketogenic diet on lipid metabolism remains controversial, and this controversy is due to the misconception that dietary fat and dietary cholesterol directly increase cholesterol levels or free fatty acids in the bloodstream. And since type 2 diabetes patients often develop hypertriglyceridemia and dyslipidemia, a high-fat diet under this misunderstanding is of course controversial. And this is one of the beauty of this study. It specifically focuses on type 2 diabetes patients using a ketogenic diet, and it measures not only weight loss and glucose metabolism, but also lipid metabolism. As it has been mentioned, this is a systematic review and meta-analysis design, including both randomized controlled trials and observational studies. The interventions reviewed across all the studies show that some ketogenic protocols used 14% of total calories from carbohydrates, other studies 10%, and others as little as 5%, and respectively 58%, 65%, or 70 to 75% of total calories from fats. And most studies show the amount of carbohydrate also in grams, and again, this goes from less than 30 grams, 20 grams, or 15 grams. So the study looked at three main outcomes. First, glycemic control, and they measure fasting blood glucose and glycated hemoglobin. Fasting glucose dropped by about 1.29 millimole per liter, which is roughly 23 milligram per deciliter. And glycated hemoglobin went down by an average of 1.07%. Now I want you to think about this. 6.5% is the threshold for type 2 diabetes. So if someone starts there and drops 1.07%, they land at 5.43%, which is actually in the normal range. Not even pre-diabetes, which starts at 5.7%. Same happens with fasting glucose. If 126 milligram per deciliter is considered diabetic, a drop of 23 points brings you to 103 milligram per deciliter, which is pretty close to normal, at least by conventional standards. Of course, those numbers could still be optimized further, but still, it's a very big improvement. Second, lipid metabolism. They looked at triglycerides, total cholesterol, LDL, and HDL. All of them improved. The changes weren't as dramatic as the glucose numbers, but the key point here is that a ketogenic diet didn't raise LDL or triglycerides, which is what people often worry about. Now, there is something called the hyperresponder phenotype, and that's not from this study, but from others, where people with low body fat and low BMI can actually see their LDL go up on a high-fat, very low-carb diet, but that's a separate topic. And third, weight management. They measure body weight, BMI, and waist circumference. On average, people lost about 8.66 kilos. Their waist went down by 9.17 centimeters, and BMI dropped by 3.13 points. So pretty solid results all around. And here again, the results are shown on this slide too. So let's talk about the strengths of the study. First, it is a comprehensive evaluation of 13 studies, allowing for a robust assessment of ketogenic diet's effectiveness. Second, is the inclusion of multiple biomarkers that provides a reliable understanding of how ketogenic diet impacts different aspects of metabolic health. And last but not least, analysis of both short-term and long-term studies to evaluate consistent outcomes over time. Also, there are some weaknesses. Also, there are many weaknesses. The number of studies is small. Only 13 studies were included in this meta-analysis, and there are only 567 participants, which restricts the generalizability of the findings. Second, the majority of participants were Caucasians, probably limiting applicability to other ethnic groups. And third, the results related to lipid metabolism were based on even fewer studies, only 8 studies, with a total of 322 participants. On my personal conclusion, I'm going to expand a little bit on this and about lipid profile too. The authors concluded that the ketogenic diet is effective for reducing fasting blood glucose, glycated hemoglobin, and improving lipid metabolism. It also promotes weight loss and may serve as a useful component of integrated management for type 2 diabetes. On my end, my personal conclusion is that the ketogenic diet demonstrates to be an appropriate and effective nutritional approach for treating type 2 diabetes. Physiologically, this isn't surprising. Type 2 diabetes is primarily and in most cases driven by excessive carbohydrate consumption, so reducing carbohydrate intake logically leads to improvements in glucose metabolism. On the other hand, the improvements in lipid profiles and triglycerides can be attributed to decrease de novo lipogenesis. We know that type 2 diabetes is about high glucose levels, just like in type 1, but in type 2 we also encounter high insulin levels, unlike in type 1, right? And contrary to what happens in type 1, a lot of the excess glucose does get into the cells, which explains the exacerbated increase in lipogenesis in type 2 diabetic patients. This results in fat accumulation in tissues and also explains the increased triglycerides in the bloodstream. So, a ketogenic diet, by reducing glucose, the raw material for triglyceride production, and by reducing insulin, which triggers lipogenesis by facilitating glucose entry into the cells, is likely to reduce and improve the lipid profile. So, even though there are only 8 studies in this meta-analysis focused on lipid profile, the underlying physiological mechanism is well grounded in science, as well as it is well understood, making these findings sufficiently robust. Okay, this is the end of the presentation. This concludes this presentation, highlighting the potential of the ketogenic diet in managing type 2 diabetes mellitus and addressing metabolic dysfunction associated with this condition.